time to join me this morning for our healthcare reform overview. We're going to do a two-part presentation today. The first part is an overview of healthcare reform. We're going to give you a basic understanding of healthcare reform in as much as what you would need as an employer to make a decision about group health insurance or not. We're not going to go into tons of detail. We're not going to wander into every aspect of healthcare reform. Only those that are kind of important for an employer to know to make a decision. So with that, let's get going. There we go. First question is, how will the Affordable Care Act affect health insurance in 2014? Now, as you know, in 2014, individual health plans will become guaranteed issue. That means there's no more underwriting. No one can be declined. That is a huge deal for health insurance. Also, all health plans are going to have at least the government-defined essential health benefits. Now, there's 10 different categories. They're listed here. It's not really important to know all of those in detail. If you've been an insurance agent for quite a while, the thing to know is that basically for individual health insurance, they're adding maternity and newborn care. Well, really maternity, because newborn care has already been in place. And they're adding federally mandated mental health, substance abuse, and behavioral health treatment. Those are the two big things being added. Now, they're also adding the last one there on the side, pediatric services, including oral and vision care. That's an awful lot of sizzle, but in reality, that's not a very expensive benefit. Probably adds $10 or $15, $20 a month to a premium. It's going to be very important to people, but it's not really that critical of a benefit. So those are the two big things that are happening to health insurance policies there. Then the last thing, that health plans are all going to be structured in a kind of a standard way using actuarial values denoted by metal names, platinum, gold, silver, bronze. Now, these are not, for instance, a gold plan is not an 80-20 plan in the sense that we understand, as agents understand 80-20 plans. A gold plan that says it's 80% actuarial value, what that means is across the typical population of policyholders, the plan is going to pay 80% of the medical expenses. For example, a silver plan that is a 70% actuarial value, it could have about a $2,000 individual deductible, and that would come with doctor office copays of say 25 and 30 for specialists, some prescription copays, and probably $4,000 of 80-20 coinsurance. Even though it has 80-20 coinsurance, it's actually a 70% actuarial value. So you don't want to get those things mixed up. There's not a lot of those plans filed yet. They're starting to show up. Over the next month or so, we'll start getting more detail on what a silver plan looks like, what a bronze plan looks like. There's one thing I did not put on here. It's not critically important, but as an insurance agent, you might be interested to know that deductibles have been capped. The highest deductible that's going to be allowed will be a $2,000 individual, $4,000 family deductible. We'll probably slip that in here in future presentations. But that's, in a nutshell, how healthcare reform is going to affect health insurance in 2014. And the big thing, the important thing about that is it puts individual insurance on a level playing field with group insurance. In the past, or not necessarily in the past, but up till now, group insurance has had an advantage over individual insurance in three critical areas. And if you've tried to sell individual plans in a group environment, you know what I'm talking about. The guaranteed issue thing creates a problem if people have health issues. Maternity has always been a problem. And then pre-X coverage. Group insurance has, for decades, included those three things, whereas individual insurance has not. Starting in 2014, both individual and group insurance are going to include basically the same coverages. So any advantages that group health insurance had structurally from a coverage standpoint are going away next year. That's going to be very important here in just a little bit as we continue our presentation. Now, let's talk about who the Affordable Care Act is going to affect. We're going to take a quick look at how it's going to affect insurance companies, large employers, small employers, and individuals. Let's start with insurance companies. A couple of years ago, the Affordable Care Act mandate for the minimum loss ratio went into effect. I believe it was January 1st of 2011. That meant that insurance companies were required to allocate 80% of all revenue to pay for claims. for the individual side. If they were a group company, it was 85%. What that meant was they're only allowed to operate their company on 20% of the revenue they receive, or if a group company, then 15%. To put that in perspective, pharmaceutical companies typically earn between 15 and 20% profit. So insurance companies are being required to operate their company on the same amount of money that that pharmaceutical companies earn in profit. And that, it sounds it sounds like no big deal, but we're talking about paying rent, we're talking about the utilities, distribution, salaries for anybody that's not associated with claims. And as you know, as you may know, with insurance companies, not everybody's in the claims department. You have people in the underwriting department and the legal department. You have people all over the place, and they have to be paid out of either 15 or 20% of the revenue from the company. There's also kind of a stipulation along with this that if an insurance company spends less than 80% of their money on 80 or 85% of their revenue for claims, that money has to go back to the policyholders. And so for the last couple of years, some policyholders have been getting kind of a little Christmas present, unexpected every year. They get a rebate check from the insurance company, and that's been kind of a welcome thing for them. Okay, then the other big thing that's going to affect insurance companies is increased taxes to help fund the Affordable Care Act. Of course, these are going to be passed on to consumers in the form of premiums. There's and all, well, 5 of these 6 go into effect this year, this fall, this winter. The annual insurance company fee, that's a 2.5 to 4% of premium, depending on the type of company it is. Any policy sold through a public exchange will be subject to a 3.5% tax on the premium. That's going to add, it adds 3.5%. There's also a market share tax. That's $8 billion in 2014. That's going to go up every year a little bit, so they say that within the first 5 years, that market share tax will have totaled $100 billion. Next year, in 2014, that $8 billion is going to add between $12 and $16 per member per month to the premium. So if you have a family of 4, it's going to add a minimum of $48 per month to the premium just for that tax. There's also what's called transitional reinsurance fee. That's going to be $5.25 per member per month, which will, for that family of 4, that's going to add $21 in tax. So just between those two, you're looking at about almost $70 in additional taxes per month just for those 2, not including the 2 above. Then there's a couple miscellaneous ones that together add about $3 per member per year. And then in 2017, the Cadillac excise tax on policies that are considered to be exorbitant in their coverage. That'd be like the General Motors UAW type of a policy that are out there that the participants pay nothing for premium and they pay nothing when they go anywhere. They have 0 out of pocket. Those kind of policies are going to be subject to a 40% excise tax starting in 2017. Obviously, the intent is to get rid of those and at that point incentivize those groups to bust up and send everybody to the exchange. So that's, in a nutshell, how insurance companies are going to be affected. Now let's take a look at how large employers are going to be affected. Now, a large employer is any company that has more than the equivalent of 50 full-time employees. We'll talk about how they figure that out in just a couple minutes. They're going to be subject to what's called the pay or play penalty. The official name is the shared responsibility penalty, and that was supposed to start in 2014, January 1st, but as most of you know, that was postponed until 2015. So large employers are going to be required to provide quality and affordable group-based health insurance to their employees, or they're going to pay a fine based on the total number of actual full-time employees less the first 30. And we'll take look at an example of that in a minute. That's going to be a $2,000 per employee penalty. Now, qualified means it has to have at least bronze level coverage, and it contains the minimum essential health benefits. And again, a bronze plan means that in a typical population, the plan will pay at least 60% of the expenses, and of course then the insured would pay the remaining 40%. Affordable, this is very, very important that this is one of those kind of things that you're going to want to keep in your mind at all times. Affordable means single coverage, that means employee-only coverage, can cost that employee no more than 9.5% of their entire household wages. Now, if it's that means even if it's a family of four, affordability is not determined based on the cost of family coverage, but on the basis of single coverage. So that's something to keep in mind. And then, of course, large employers, and this is going to be a really big deal for them. We're not going into a ton of detail, but there is a ton of detail under this. They have extensive reporting on their health plan if they have one in place. In fact, most larger employers, they're going to have to add staff just to take care of this. And there are substantial penalties for not complying. Some of those penalties are 6 digits a day, $100,000 a day that they don't comply. And so, that's something large employers are really taking fairly seriously. Okay, so that, in a nutshell, is how large employers are going to be be affected by the Affordable Care Act. Now, the key takeaway here is that pay-or-play penalty. Let's take a quick look at how they calculate that. Again, if an employer has more than 50 full-time employees and does not offer group, he's going to be assessed a penalty on all but 30 of those employees. So if someone had 72 full-time employees, it would be 72 minus that first 30, which would be 42. The penalty of $2,000 would be calculated on those 42 employees, or $84,000. Now, for employers that have less than 50 full-time employees, but more than 30, they have to be careful, because if they don't want to necessarily start dancing in the streets because they don't have to pay that penalty or offer insurance, because of part-time employees, those part-time employees could bump them up to large employer status. And the way that works is they take all the hours worked by part-time employees, add those up, and divide by 30. 30 is the new standard for full-time under the Affordable Care Act as it relates to health insurance. So in this case, we have an employer that has 43 full-time employees, but he has part-time employees that work a total of 270 hours per week. They'll probably be calculating this on a monthly or quarterly basis. Probably on a monthly basis is what they'll actually be doing with a 6-month look back in all likelihood. But for purposes of just understanding what's going on, we'll just take a look at it on a weekly basis. So there's 270 hours worked in a week divided by 30 equals the equivalent of 9 full-time employees. So you add that 9 to the 43 to come up with 52, which means this employer is now considered a large employer, and if he does not offer health employees, he's going to be penalized on his full-time employees, only his full-time employees. And so since he's not penalized on that first 30, you subtract 30 from 43, he's penalized on 13 employees, so he has to pay a $2,000 penalty times 13 is $26,000. Now, there's one more part to this penalty, and this is for an employer that offers health insurance, but he has employees that opt out of the program because they can't afford it or whatever the case may be. Now, in the event that an employer offers group health insurance and employees, full-time employees, go to a public exchange and get a subsidy, he's going to be charged a penalty on them. Now, keeping in mind that, and this is also, again, very, very important, the employer is going to be subject to a penalty of $3,000 per employee that opts out of the group to get a subsidy on the public marketplace. And here's the important part. In order to get a subsidy, the employee's cost for self-only coverage has to be more than 9.5% of their household income. Again, we're going to look at some examples in the second presentation that show just how unlikely that's going to be, but assuming that it does happen, if an employer had 12 employees that opted out because of cost and the coverage was not considered affordable, then that employer would have to pay a $3,000 penalty per employee, which would be $36,000. Now, this penalty is capped at the total amount that the employer would have to pay if he didn't offer health insurance at all. Basically that $2,000 pay-or-play penalty. Now, I've done the math, and it seems that it would have to be 2/3 of the employees would have to opt out and go to the exchange and get a subsidy in order for it to max out. That's going to be, in most cases, that's going to be extremely unlikely, but I suppose it's possible. All right, that takes care of the large employers. Now let's take a look at how small employers are going to be affected. A small employer is any employer with less than the equivalent of 50 full-time employees. We've already taken a look at what that is considered. Most of the requirements of healthcare reform are not going to apply. The biggest thing is they're going to be required to provide notification to their employees that they can get health insurance through the public marketplaces. There's a form that they're going to have to distribute every open enrollment period so that their employees are aware of the public marketplaces and how to get to them. That's probably the most significant thing that they're going to have to do. They're not subject to the pay or play penalty. Now, and this is something the government's got out there that they're pretty excited about, but in all reality, it's pretty much sizzle. If a small employer offers a group health plan, they may qualify for a tax credit of up to 50% of the premiums that the company pays, not including the employee portions. Now, that tax credit already exists. It's 35% now. It's been around for a few years. It caps out at $50,000 average salary and I think it's 25 employees now, or 50. I think it's 50 employees now. At any rate, it's going up to about 100 employees next year, and still staying at 50,000 average salary. The problem with this tax credit is it's kind of convoluted to get, number one, and number two, the closer a company gets to either cap, the closer that tax credit gets to zero. So usually it's not been worth getting. I haven't really come across any companies that have actually even tried to get it. The shop exchange that's supposed to have gone into place this year, that's been postponed until next year. That shop exchange is kind of built around this concept of the small tax credit. We'll see how that works out in 2015. Okay, that pretty much handles small employers. Now we're going to get to the part that we actually need to pay attention to. How will the Affordable Care Act affect individuals? Now, the first thing is the individual mandate. That means starting in 2014, every citizen in the United States is going to be required to have qualified health insurance or pay a penalty. Now, there are some exclusions. We're not going to go into those. Native Americans and some people that are part of some specific religious groups and a few others that are excluded, but for practical purposes, it's everybody. If they don't have qualified health insurance, that penalty is going to be $95 per person in the household, or 1% of their income, whichever is greater. In 2015, that penalty goes up to $325 per person in the household, or 2% of income, whichever is greater. And in 2016, that goes up to $695 per person in the household, or 2.5% of income. Now, it's interesting because there's a one-year gap between the individual mandate and the business mandate now with this postponement of the pay-or-play penalty. So it's going to be interesting to see if in the next few weeks the government doesn't do something to appease those people out there that are raising all kind of cane because businesses are getting a break and individuals aren't. It's just interesting to see what happens there. I wouldn't be surprised if they do anything. I wouldn't be surprised if they keep it in place or if they postpone it for a year. I'm kind of leaning, I think, toward they're going to keep it in place because they really want people to get dependent on the government for this insurance, because I think that's part of their overall goal. Now, the next thing has to do with Medicaid. This is very important, and you don't hear an awful lot about it. Part of the Healthcare Reform Act requires states to extend Medicaid from current levels of eligibility up to 133% of the federal poverty limit. Now, typically in most states, Medicaid is based on 100% of the federal poverty limit, and every state varies, but by and large they kind of follow this model where if you have kids and make less than 100% of the federal poverty limit, your children qualify for Medicaid, you do not. If you have children and make less than 50% of the federal poverty limit, then you qualify for Medicaid. That's kind of, there is no actual standard, but that's kind of the norm out there. This is important because the subsidies that we're going to talk about in a few minutes are only available to people who make between 100 and 400% of the federal poverty limit. And so the problem is that last year the Supreme Court struck this down. The law required states to extend Medicaid. The Supreme Court said that they constitutionally didn't have the right to do that, so the states get the option of extending Medicaid. So far, only 15 or 20 of them are. Well, so far, only about 15 of them are. 5 or 6 are considering it. 25 or 30 are just not going to do it. In those states that do not extend Medicaid, there's going to be this gap. Anybody that's making below 100% of the federal poverty limit is not going to be eligible to receive any kind of a subsidy. So as a result, in those states, those making below 100% of the federal poverty limit that don't currently qualify for Medicaid, they're not going to receive any kind of financial assistance from this law. Because we live in an entitlement society, even though they're no worse off than they are now, because people around them are getting help and they're not, that's going to create an awfully large problem if our country holds to the way it normally does things. So watch this. You need to make, if whatever state you are working in, make sure you know if that state extends Medicaid up to 133% or not. It's going to be very important to the way that you sell. But now, that's kind of the negative. Let's start looking at some of the positive of what's happening to individuals. Premium subsidies. This is kind of the big headline item with the Affordable Care Act for individuals. That means families and individuals that are not eligible for an employer-sponsored group insurance plan and making less than 400% of the federal poverty limit might be eligible for a subsidy to cover most of their premium costs. Now, subsidies vary based on income and family size and the cost of the baseline silver plan in each state. The baseline silver plan in each state is typically going to be the second least expensive silver plan in the state. Now, if that state is, if they have their own exchange, that's how they'll do it. It remains yet to be seen how they're going to handle it if the state is in a partnership with HHS or using one of the federally built exchanges. In all likelihood, the federal government then will pick the baseline state plan from a pool of national plans as opposed to using something in the state level. Now, here's how the premium subsidies are going to look. This is you're basically going to take the percentage of income that you're required to pay for insurance, and the amount that you're required to pay is a set amount based on your percentage of the federal poverty limit. And you take that amount and you'll subtract it from the premium for the state baseline silver plan. So let's just say that the state silver plan costs $10,000 for a family. That's going to be kind of low, but so let's just say it costs $10,000 a year for a family, and let's say that that family is required to pay $5,000 a year for their insurance. So that means that their subsidy is going to be $5,000, the difference between the cost of the insurance and the amount they're required to pay. So that number is going to be kind of a floating number from person to person and from state to state. The number that's not going to float is the amount they're required to pay. And that's really the important number to keep in mind when you're talking to people. The amount of their subsidy is only important if they're going to use it for something other than for the baseline silver plan. And this is how it will work. If someone makes 250% of the federal poverty limit, you can see that right down here, they are going to be required to pay 8.05% of their income for health insurance premiums through the exchange. So if they're single, if they're single, 250% of the federal poverty limit is $28,725. 8.05% of that is $193 per month. So if somebody is single making 250% of the federal poverty limit and they buy a subsidized plan and they get the baseline silver plan in the state, they're going to be paying $193 a month. That is, it might vary by a couple of dollars just because of the way percentages float, and maybe I calculate carrying the one and maybe they don't carry the one or something like that. At any rate, if you're a family of four making 250% of the federal poverty limit, you are earning $58,875, and you are going to be paying $395 per month. Again, $395 per month is 8.05% of $58,875. So this is probably the most complicated part, and we have there's tools out on the internet. I've built some tools that most of you have access to. The tools we have out there that we have on our website take all of this stuff into account, so you don't have to know how to calculate it. You just have to understand kind of the moving parts. So when people have questions, you can explain it to them. Here's a little bit more about how the premium subsidies work. The subsidy is actually a tax credit. You can apply for it through the public marketplace or a qualified private exchange, something like we will have, before you apply for insurance. Now, eligibility, family income has to be between 100% and 400% of the federal poverty limit. You must not be eligible for affordable and qualified employer-sponsored health coverage. The health plan has to be applied for during an open enrollment or special enrollment period. And as a note, the first open enrollment period is going to be between October 1st of this year and March 31st of 2014. And the subsidy has to be used to purchase a policy through the public marketplace. The application is made using the modified adjusted gross income for the most recent completed year. What they'll do is the modified adjusted gross income is your regular adjusted gross income plus Social Security, interest income, and a few other things. So the Social Security thing is going to come into play if you have a family where a spouse is under 65 and the other spouse is over 65 collecting Social Security. Again, this is going to be a little bit confusing for people. The IRS, I'm sure, has already built the form that's going to be used to keep track of this. Now then, this is the important part. The only reason somebody would apply for a premium tax credit during open enrollment is if they wanted to use that to help offset the cost of their insurance premiums, because we all know these insurance premiums are going to go way up. Estimates are that they're going to go anywhere from 50 to 150% up from where they are now. They're going to get much closer to small group insurance rate, which are typically about twice what individual rates are. Well, if you qualify for a premium tax credit, that premium tax credit can be applied as an advance payment to your monthly insurance premiums in order to make them affordable. So really, it's just going to cause a little confusion, I guess. No one's really going to apply for a tax credit and then wait until the end of the year to get it. Everyone that applies for it is going to use it to apply to their premiums. Now, these payments will not be sent to you as the taxpayer. They're going to be sent directly to the insurance company. So you won't have to worry about, cashing a check and sending it on. The government's going to take care of that. So that's basically how the premium subsidies work. Now, here's kind of the downside of those premium subsidies. There's going to be a reconciliation on the 2014 tax returns. And while the application process is going to use 2012 or 2013 income, which in several states won't even be verified, the actual premium tax credit is calculated using 2014 income. So any 2014 advanced subsidy payments received are going to be reconciled using 2014 income on your 2014 tax return, even though you used a different number to get the tax credit. What that means is if you make less in 2014 than you did in the year you used to apply for the credit, the additional amount you should have received will be added to your tax return as a credit. However, most people, I think the number is something approaching 60% of the Americans out there, typically make more than they did last year. As you go from year to year, people typically make a little bit more every year. If you happen to be one of those people and you got an advanced tax credit payment to your insurance, then what's going to happen is you're going to actually owe some of your tax credit back. They're going to have paid you more than you deserved, and that's going to be a debit on your 2014 tax return. So I think this is going to make an awful lot of people unhappy when they get their great big subsidy, or if they try to cheat because they're in a state that doesn't require income verification and they try to put a little lower number in there than they actually made. Well, when it comes to 2014 tax time, whatever you've done has to be reconciled using your income from 2014. So I think there's going to be quite a few unhappy people come 2014 tax season. Now then, this is the last slide that we have to go over for the healthcare reform overview. And this is another part of the premium of the subsidies. There's what's called a cost-sharing subsidy. In addition to the premium subsidy, the actuarial value of the baseline silver plan is going to be adjusted for families and individuals at or below 250% of the federal poverty limit to help control their out-of-pocket costs. Now, these numbers are actually wrong. Single coverage is, I got to change these are the HSA limits for 2014, but the HSA limits are not what they're actually using for limits. The plans next year, I believe it's going to be $63.50 and $12,750, or $12,700, I think is what it is. At any rate, it's only off by about $50 or $100 there. What's going to happen is if you make between $100,000 100 and 200% of the federal poverty limit, that out-of-pocket limit is going to be reduced by 2/3, so that if you make between 100% and 150% of the federal poverty limit, your 70% actuarial value plan is going to be adjusted so that it becomes a 94% actuarial value plan. If you make between 150 and 200%, that plan is going to be adjusted so that it becomes an 87% actuarial plan. Just so you know, there's a calculator that the government's put out, and it's not incredibly accurate, but it's range accurate. Platinum plan, the 90-10 type plan, putting some numbers in there, came up with a $250 deductible with $1,000 of 80/20 coinsurance, some low doctor office copays, some low RX copays. So that's a pretty rich plan, and this is going to be even richer. And again, if you qualify for this, the insurance company is going to file plans that you'll qualify for, so that there's not going to be any guesswork about how much you should be paying, how much they should be paying. The plans themselves will already be filed as options, a 73% option, an 87% and a 94% option for the baseline silver plan. Those will already be filed. You'll only pay 70%. The government will send periodic payments to the insurance company to cover the part that you're not supposed to pay. So that takes care of the first part of the presentation. I am going to unmute everybody. If you have any questions, now's a good time. So does anyone have to unmute everybody? If you have any questions? And if you don't have a question, go ahead and mute it. And if you don't have a question, go ahead and mute it.
Scott?
Yeah.
Which states are extending the Medicare? Which states are extending the Medicare?
Medicaid?
Yes.
I don't know that list. Yes. I don't know that list. If someone's got me on speaker, they need to mute their phone. Someone's got me on speaker, they need to mute their phone. There we go. I don't know. I'm working on that list right now. I don't know. I'm working on that list right now. I know there's folks in Texas and Michigan. I know there's folks not going to. Michigan has Michigan probably not going to. Michigan. There we go. That's a little. I'll just have to. I guess what I'll have you do is type your questions in. That way I can. I'll just address them that way. That way we can hear better. So if you have a question, type it in, and we'll just go on from there. There's too much background noise. Michigan has not extended Medicaid. The expectation is that they probably will. They've got a pretty strong plan built for it, and the governor is pushing real hard for that. I'm working on a list. It's kind of a moving target, and it's kind of hard to know, who is and isn't. For instance, there's a lot of information out there, for instance, that says Arizona is absolutely going to extend Medicaid, or they already have. But then when you look at other information, it's like they absolutely have not, and they have zero plans to do it. So it's kind of hard to know, who is and who isn't. The best thing to do is for the state that you're in, you'll probably want to take a look at that. So let me see if I have any questions that I overlooked here. Okay, we already addressed that question. There we go. Okay, yeah, and Jeff is letting us know that the Kaiser Foundation, that's kff.org. They have some Medicaid information. I've looked at that, and theirs is probably the most reliable, but nobody is really. Nobody's keeping up a list yet. So, all right, with that in mind, I'm going to switch to our other presentation. All right. Again, we're going to start the second presentation, which is how you can use the Affordable Care Act to create a world-class employee health care benefit. This presentation builds on the information that we used in our healthcare overview. presentation. And basically what we're going to focus on is what healthcare reform can do for you. Now, there's an awful lot of, I guess, activity out there, and all the conversation is based on, oh my goodness, what is healthcare reform doing to us? It's going to kill us. It's this. It's this. It's all woe is me. But when you stop and look at the law itself, regardless of what you think about the law as a whole, you could think that this Affordable Care Act is the worst mistake our country has ever made and is a dagger to our heart, or you might be in the camp that thinks it's the best thing that's ever happened since the signing of the Declaration of Independence. That doesn't really matter. The fact is, the Affordable Care Act is here. It's the environment that we have to work in. So when you look at what we have to work with, regardless of how long you think it's going to last, regardless of what is it a good idea or not, it is the law. So let's take a look at how we can work with this law to make a better environment for ourselves as long as it lasts. So the first thing we'll do is we're going to take a look at, hopefully, there we go. We're going to look at the basic questions surrounding the Affordable Care Act as it relates to employers. And this is it. Are they going to go with or without group health insurance in 2014 and 2015? This is the central question for employers. What do we do with group health insurance? Do we keep that plan in place in order to keep our employees happy and comply with the Affordable Care Act? Or should they go without group health insurance, send their employees to the public marketplace, and take any penalty that they may have coming? And then how do they decide? Do they decide based on what's best for the company or what's best for the employees? This is the central problem for employers, large and small. Well, here's what we think. What if the best option for the company and the best option for employees were the same thing? Now, there is an option that may well be the best financial choice for both the business and that business's employees. And we're going to take a look at that. But before we do, we need to address the misconceptions that are out there for 2014 and 2015. These are the things that get in the way of employers making an informed decision about how to proceed. Here's the first one. This is huge. Group insurance is the best way for employees to get health insurance. It provides better coverage. Of course, it's guaranteed issue and covers things like, covers things that individual doesn't, like maternity and pre-X. And it's more affordable for employees. Employees generally, because the employers generally subsidize the higher cost of group. As you know, if you sold insurance for any length of time, group insurance typically costs 50 to 60% more, or I'm sorry, the individual costs 50 to 60% less than a comparable group plan. Now, part of that's because of what it doesn't cover, but also part of it's because of the lack of guaranteed issue, the adverse selection, all that kind of fun stuff. And if you don't think you believe this, if you don't think you believe group insurance is the best way for employees to get health insurance, just think back to the last time someone you know that's close to you got a job. What's the first question that you ask them? Does it have health insurance? That's the first question we ask somebody when they get a new job. Well, tell me about the benefits. Does it include health insurance? In everybody's mind, emotionally, we believe that group health insurance is the best way for employees to get health insurance. Now, that's really not true, and it hasn't really been true for quite a while. And as we're going to see in a few minutes, it's not at all true in 2014. But right now, this misconception is getting in the way of a lot of people making a good decision. The second misconception is that in 2014 and 15, it's going to be best for employers to keep their group insurance in place, even though employees have to help pay the cost of premiums. And so those employees that can't afford that and opt out, they can go to the government marketplace and get a subsidized plan. Okay, misconception. We're going to take a look at that in just a couple minutes. And then the third and final misconception is the government marketplace is the only place that you can get individual insurance if group insurance is not available. This is pretty pervasive. It's not as pervasive as these other two, but it's pretty much out there. Places like California, agents I've worked with in California, they absolutely believe this. Even the agents believe this. That you can't buy insurance anywhere but a public marketplace through a navigator. And so a lot of agents are figuring out, well, should I become a navigator or not? And we're going to talk about that a little bit as well, because that's actually going to affect how we interact with our clients. So let's dive into this. will group insurance provide better coverage than individual insurance in 2014? Now, we're going to take a quick look again at a recap of some information from the previous presentation, but it's in here again because quite often this second presentation is given as a standalone. So, health insurance plans, or individual health plans rather, will be guaranteed issue in 2014. No more underwriting, no one can be declined, no pre-existing exclusions if purchased during open enrollment, and they have all of those essential health benefits. We've already talked about that. Now, we've also already seen this. From a coverage standpoint, starting in 2014, group and individual are going to be on a level playing field. So basically in 2014, individual health insurance will have the same level of benefits that group insurance will have. So that advantage is gone. The coverage advantage for insurance, for group health insurance, is gone. Now, let's take a look at the second part of that misconception. Will group insurance be more affordable than individual insurance in 2014? Remember, right now, the employer sponsors, subsidizes the group health insurance so that the cost comes down to something that most of his employees can afford. That's kind of changing with the escalating cost of group insurance. More employees are having to pay a higher percentage to the point that most of them can't participate. But assuming that the employer sponsors it, will it be more affordable? Let's take a look at that. Here's a typical employee. This is an average person, 45 years old, family of 4, making $45,000 a year. If the employer offers health insurance, according to Kaiser, the average cost of that health plan is $5,500 a year for single coverage and $16,000 a year for family coverage. It was actually high $15,000, but to make the math easier, I rounded up about $300 thereabouts. So it's just the disclaiming there. Now, let's assume that employer pays 50% of single coverage. Now, when you get outside of heavily unionized areas like Metro Detroit, when you get into the bulk of the country, this is the norm, where the employer pays 50% of single coverage, and the employee, if they want family coverage, they have to pick up the difference. In this case, that employer is going to pay $2,750, half of the single coverage. If that employee wants coverage for his entire family, he's going to have to pay $13,250. Now, he's just not going to participate. $13,000 is almost a third of his income. After the tax benefit, it's probably at least almost a quarter. Excuse me. So unless he has a spouse or a child with a dread disease that costs more than that to treat, he's not going to participate. So let's say the employer bumps it up a notch and he pays 50% of the family coverage. So he's going to pay, instead of $2,750, that employer is now going to pay $8,000 a year, and the employee for family coverage only has to pay $8,000. That's going to still be well over $700 a month. And the employee, you'll probably have better participation, but that's still going to be pretty steep. Excuse me. Now, let's assume that the employer says, you know what, let's just get rid of this insurance plan. Everyone can go to the exchange in 2014. Let's take a look at how they're going to fare. If they have to go to the marketplace, the employer is either going to pay zero, or in 2015, he may have to pay $2,000 per employee, depending on the size of his company and if the government actually institutes those penalties. But that employee is only going to have to pay $2,672 a year for family coverage. And what's more, because of the cost-sharing subsidy, that plan is going to be adjusted from a 70% actuarial value up to an 87% actuarial value. That's only like a point away from being platinum. So the cost-sharing subsidy is going to take his silver plan and jump it almost 2 metal levels. His annual out-of-pocket cost is going to go from $1,260 down to $4,200. There's nowhere in the country you can buy this plan for these costs. You can't buy a plan like this here for this kind of money. Even if the employer has to pay $2,000, you can't buy this plan for $4,600 a year. So what we're seeing here is that the government is going to be subsidizing plans in a way that businesses can't. And so what we're suggesting is the employer doesn't want to fight these subsidies, rather cooperate with them. We'll take a look at that a little bit more later. Now, Excuse me. Let's get back to this employee. Here is his choices. In the event that the employer offers his group health plan, he has a choice of paying between $8,000 and $13,000 for family coverage from that employer's plan, or he can go out and pay an estimated $12,500 per year for private insurance. That's Kaiser's estimate for that plan. It's going to vary based on what state you're in. Or they can go without health insurance and pay a penalty in 2014 of $350. That's his choices. Now, if the employer gets rid of group health insurance, here's his choices. He can pay $2,700 a year, that's, rounded up, for the government subsidized family coverage, or he can pay $350 a year penalty and go without insurance. Now, which of these options look more appealing as a group? Certainly, with the employer getting rid of group insurance, that's the best set of options for this employee. Now, we're not telling it, at this point, we're not going to tell an employer, you have to drop group. What we want them to do is we want them to get an analysis. Let's take a look at how your employees will be affected so that you can do the right moral thing for your employees and the smart thing for your company financially. Now, we're talking to that employer, and he's like, well, should he keep his group plan in place? Now we're on to that second misconception. Well, here's the thing. In 2014, if an employer has a group plan in place that is considered qualified and affordable, employees that opt out will not be eligible for any of the Affordable Care Act subsidies. Excuse me again. Remember, to qualify for a subsidy, the cost for self-only coverage to the employee has to be more than 9.5% of their household income. And that's regardless of actual family status or coverage. Let's take a look at what that means in real numbers. Now, at every seminar you go to, they'll tell you all this. But what they won't do is this next part, which says, let's look at the real numbers. Let's say that the employee portion of self-only coverage is $1,000 a year. That means anybody making more than $10,526 will not qualify for a subsidy. If they have to pay the national average, which is about $5,000 for single coverage, and the employer pays 50% of that, that's $2,500 that the employee would have to pay for self-only coverage. Well, $2,500 is 9.5% of $26,315. That means anybody making more than 26 in a company, anybody making more than $26,315 household income will not qualify for a subsidy. And by way of reference, the single poverty limit is $11,490 for a single person. For a family of four, the poverty limit is $23,550. So you can see, best case scenario, if you got to pay half of the employee-only coverage, a family of four has about a $3,000 window that they can be in and qualify for a subsidy. So what that means is most employees are either going to not qualify for a subsidy because they're below poverty limit, or they're not going to qualify for a subsidy at all because of the upper cap. So what's going to end up happening is most people out there, if their employer offers group health insurance and it's qualified and affordable, most people are not going to qualify for a subsidy. I mean, some people will, but by and large they won't. And nobody is really talking about this. This is kind of a death knell for group insurance. So if you have an employer that is kind of wavering, yes, should I, shouldn't I? When you show them this and they realize that anybody making more than, let's say, if he's only making them pay $1,000 and they're not participating, if he realizes anybody making more than $10,500 won't qualify for a subsidy, which will be everybody, then he'll realize he's blocking people from getting health insurance. So what you're going to have then is you're going to have a situation where employees are going to be coming to employers and saying, hey, drop group health insurance, you're killing us. The employees are going to be on your side, and from the employer's standpoint, that group health plan he has in place, which he thinks is helping him attract, retain, and reward his employees, is actually repelling them. So it's going to be, the employer going to have to find a different way to go about things. And so we've got an idea for him. Now let's take a look at that last misconception. Is the government marketplace the best place to buy insurance? This is going to the question here is going to kind of revolve around navigators on the public marketplace. Here's what they can and cannot do. They will not be required to be licensed. They could actually be a felon, as it turns out. They can only answer questions about marketplace health plans. They can assist in subsidy and plan applications, but they cannot offer advice to applicants. They cannot sell health policies outside the marketplace, and they cannot sell other products to marketplace customers. They also can't provide after-the-sale service. What that means is particularly the thing that they can't sell health policies outside the marketplace. If they're talking to somebody who makes more than 400% of the federal poverty limit and does not qualify for a subsidy, they can't tell them, hey, you know what, you should probably look outside the marketplace because plans out there are going to cost less. They can only offer plans in the marketplace. So if you're talking to a navigator, you're not getting the best amount of choice that you're going to have. And I guess I should follow up on that a little bit. As you know, or may not know, plans outside the health exchange, outside the marketplace, should cost substantially less than plans inside the marketplace. At a minimum, they're not going to be subject to that 3.5% marketplace tax. But if the plans were filed separately from the plans, if you got two plans that are similar, one was filed as a marketplace plan and the other was filed as an outside the marketplace plan, the plan outside is not likely to have the same cost ratios that the one inside will. I mean, think about it. All the poor people that really need health insurance are going to be in the exchange taking advantage of those subsidies. Now, without being rude, as a social group, who is likely to be less healthy? Rich people that have to buy their own insurance, or poor people who have to get a government subsidy? Well, sadly, in our country, the people who are poor typically have terrible diets. They don't typically take as good care of themselves, and they typically use medical expenses at a much higher rate than people that are more affluent do. So if the people that have to buy their own insurance go outside the exchange to buy it, their cost ratios, their expense ratios are going to be quite a bit lower. The MLR, being as tight as it is, will drive those premiums down, so that those premiums, in addition to the 3.5% savings on the tax, could see a 10, 15, or more percent difference in premium just because of the MLR and reduced utilization. A navigator is not going to be able to tell them that because they cannot offer advice. They also can't offer any kind of plan that's not an insurance plan, so they can't build a program. They can't offer an accident plan if it's standalone. They can, if it's a rider on a plan, they can tell the person about it. But if somebody, they can't say, I think you got you're 35 years old with a couple of 10-year-old kids playing sports. You probably need an accident plan. They can't do that. Where we can, insurance agents are going to be allowed to guide the people through the subsidy application process. We're going to be able to sell policies that are offered in the marketplace. We're going to be able to sell policies and products that are not offered in the marketplace. And the most important thing is we're going to be able to provide consultation and advice on products in and out. So we're going to be able to offer a much better solution to people than the government's going to be able to offer. Because we're going to be able to offer what the government offers plus a lot of other stuff that people actually need. So the government marketplace typically, and specifically the navigators, is not the best place to buy insurance. The best place to buy insurance is still going to be through an insurance agent, either individually or representing a private exchange of some sort. Now, the government has said that sometime after August 15th, they're going to be releasing the course that we have to take in order to qualify to represent the exchange. It's supposed to be a 30-hour course, so we'll see how that goes. They haven't got the exchanges up yet, so it remains to be seen how they're going to get the courses up if the exchanges aren't actually up yet. But what they've said is at some point before open enrollment begins in October, they're going to release the course we have to take in order to certify. It may be the day before, but it should at least be before. So in summary, we're going to revisit those misconceptions. Group health insurance is not the best way for employees to get health insurance in 2014. Government subsidized individual insurance will often be the most cost-effective coverage for the company and the employee. Even though employers do not have to deal with the Affordable Care Act compliance until 2015, employers that keep a group plan in place in 2014 will likely be blocking employees that opt out from being able to get any sort of subsidy. And then, of course, that third one, employers that do not offer group health insurance should work to encourage their employees to work with insurance agents instead of going directly to the public marketplace. Now, with that in mind, now we're going to start talking to them about how to build a world-class health care benefit program. We're going to talk to an employer. Hey, let the government subsidize your employees' health insurance. Ask an employer, hey, last year, how much did you spend on health insurance for your employees? How much did the company spend? You don't need to know the number. Just say, hey, get that number in your head. And then ask them, how much money did your employees contribute as a group toward health insurance last year? Get that number in your head. And then say, how much did the government pay toward your health insurance, your employees' health insurance last year? Now, so far, that number has been zero every single time because nobody's taking advantage of that small business tax credit. And so what you can ask them is, hey, how about next year we have the government pay half or 2/3 of the cost of your employee health plan? And then any money that you're spending can be repurposed. So that's what we do. We'll tell them, let the government pay for the base health insurance plan, and then you can redirect a portion or all of the money that you're currently spending on health insurance product to other employee benefits. You can give them a raise or a bonus. You got to be careful if an employer is going to do this because it is taxed, and a raise particularly is easily forgotten. If they're going to give this money to their employees to use for health care, they might want to do it in the form of a bonus that has a label on it so they can see it every week or every pay period. They can also buy other supplemental insurance coverages like accident, life, that sort of thing. They can also establish HRAs or HSAs to cover out-of-pocket medical expenses. This is a big deal because those plans on the exchange are going to come with out-of-pocket. So, the employer could redirect money he's paying to premiums now to help cover out-of-pocket costs later. So there's all kinds of ways to build a program that cooperates with a government subsidized plan. Now, he's also going to want to establish a PRA for those employees that will not qualify for a government subsidy. Now, what that means is he has employees that are making more than 400% of the federal poverty limit, and when he drops group, they also lose their coverage, but they're not going to get any kind of subsidy. If he puts a PRA in place to allow them to pre-tax those premiums that they have to pay, it might actually end up. There's another presentation we have that talks about strategies for different levels of employees. But in short, somebody making 400% or more of the federal poverty limit that has to buy their own premium, they can end up paying about half as much as they would for a plan inside the exchange by buying one outside the exchange when you take into consideration the difference in taxation, the difference in MLR and utilization, and the tax savings of 30 to 40% depending on what their tax bracket is. They can end up paying half or less of the cost of a plan in the exchange if a PRA is in place. And so it could end up being more money than the employer is contributing to their plan now. And then, of course, the employer is going to have to work with you to educate their employees on the merits of this new benefit structure because, as we, that first misconception is really strong. Everybody in the country pretty much believes that group health insurance is the best thing out there. And so if an employer says, hey, we're going to drop group and go to the exchange, you better be prepared to educate the people that work for them so that they can understand, hey, this is a great thing. And even though yesterday I would have killed him if they said he was going to do that, I want him to do it now because once they understand the environment and they understand what's going to happen, employees are going to want this. It may take them a little while to figure it out, but if you do the right kind of presentation to them, the right kind of education, they're going to get it, and they're going to get it quick because everyone out there is looking out for themselves. Those benefits, once they understand that the government's going to do a better job for them than their employer can, and their employer's contributing with it, or participating with it rather, they're really going to like it. Now, the last thing we're going to have an employer do is establish a private exchange that will service all their employees and brand the benefit to your company. Now, this is a if you're working as an individual agent with businesses, you're creating much more work than you can possibly handle. If you get into a business that has 50 or 100 or 200 employees, you're not going to be able to write that business yourself. That would take too long. We have a private exchange solution. It's a branded website along with a branded call center that you can take advantage of that will take care of that overage for you, and then you get a percentage of whatever they make. Cool thing is it's American agents calling from the United States, so that's a big deal with this call center. And then, of course, you want to put together coordinated employee benefits, health insurance, supplemental, that sort of thing. So an employer has an awful lot of things he can do to build a structure that will, to his employees, look like an expanded, large benefit program, and it can either cost him zero if he doesn't offer insurance at all now, or it can cost him no more than he's already paying now, or it can save him all the money he's paying now, depending on the direction that he wants to go. There's an awful lot of things the employer can do. So, what should employers do now to prepare for this? First thing they need to do is to schedule an assessment of the impact of healthcare reform on their employees to determine options for their companies. Those assessments are available through our toolbox. You can't do them yourself. You have to request those from us. And we'll talk more about that in another presentation. But that's going to be baseline. They need to know how their employees are going to be affected if they keep their group plan in place or if they drop it under healthcare reform. And then they need to make a decision to implement a government-subsidized health insurance program and determine how they're going to build on those government subsidies. Once they've done that, they need to establish a PRA for those employees currently not covered by a group health plan, and those that will not qualify for a subsidy in 2014. So if you're working with a group that has opt-outs and you get something going right now, you can service those employees that are not on the group. They can start pre-taxing their own insurance through an employer's plan right next to a group plan, as long as the employer is not contributing to it. Then they need to establish a branded exchange that provides access to products and subsidies and products in the marketplace and outside the marketplace, along with agents that provide one-on-one benefit and reform consultations with employees. Ongoing support and consultation is needed. I'm using the word private exchange. Every one of us as insurance agents are a private exchange. All that is a place to buy private health insurance. Now, that private exchange can take the form of me or you, or it could take the form of that call center. But you want the employer to establish a relationship. This is our go-to supplier. So if the employees know this is who they're going to be working with, this is how they're going to be working with them. And then they're going to schedule one-on-one healthcare reform consultations for their employees. This is optional depending on the direction you go. I think it's smart if you're, particularly if you're selling the business yourself, sit with those folks now. Use our healthcare reform employee impact tool to show them what they can expect. Gives you a sales opportunity now, allows you to schedule a sales opportunity again for open enrollment period, and gives you some great referral generating opportunities as well. So then what should an employer do to prepare for 2014, the fourth quarter? They need to schedule healthcare reform transition consultations for their employees with their private exchange. That's you or the call center. And at that point, you're going to take a look at their actual subsidy eligibility. The cost and structure of their existing coverage will be compared with the cost and structure of their subsidized plan. Then agents are going to help employees get their subsidies and the insurance package that will best fit their needs and opportunities in 2014. I think I'm going to skip this part. This has to do with defined contribution. We'll do this in another presentation because time is short. So basically, every company is unique. When you're talking to an employer, you need to make sure they understand they have more options than they think. Right now, they only think that they have options relative to how are we going to deal with that $2,000 penalty. When you look at the solutions available to the employer in context, that $2,000 penalty, if it ever comes to be, is actually going to be shown to be kind of secondary or even not really all that important. In terms of what it means to their company, what it's going to mean to their employees. Keep in mind, when you're talking to employers, time is getting short. Open enrollment starts in October. Agents and consultants that can provide the expert advice that they need are going to be busy. So they need to schedule a benefit plan consultation soon because basically, hey, we're going to be busy come October, and so they need to kind of get in line now. So with that, I'd like to thank you for your attention. That's the end of this presentation. I'm going to, if you have any questions, go ahead and type them in. And we'll go for, see anybody. I can't imagine I did that good a job, but no one had any questions. I'm going to unmute you, see if we don't have too much background noise. So we can do that. All right, does anyone have any questions?
Hey, Scott, this is Victor.
Hey, Victor.
Just wanted to let you know that I attended a Blue Cross Blue Shield meeting yesterday for small employers put on by Action Benefits. And one of the things that they talked about for their bronze plan is that their deductible is going to be about $3,000, not the $2,000, $4,000. And the reason why is because their actuaries were unable to actually get their actuarial value down to a 60% without increasing the deductible. So apparently, CMS or HHS has put in a mechanism so that insurance companies can petition to increase whatever the numbers they have to increase jockey around, whatever the number, in order to make the AV come out 60, 70, 80, 90%.
Okay, very good. All right. Does anyone else have any questions or comments? All right. Well, hey, I really appreciate everyone's attention, and we'll be having, you can go look on the website. I'm putting an event page up there over the weekend. We'll be doing some regularly scheduled webinars. I'll send out email invitations to those, but you'll be able to see them on the website and register for them there. We'll be doing webinars, various tools, the different sales methods, that sort of thing, over the next 2 or 3 weeks. So, again, I'd like to thank you for your time, and I hope you guys all have a wonderful day. If you have any questions, feel free to email me. Oh, there's a question. The strategy email, I'm sorry, the strategy presentation, that is the next one we did. We did that one last week. I'll do that again. I don't have a scheduled date for it. It'll probably be the middle of next week. I'll schedule that over the weekend and put that up on the website and send an email invitation out to everybody. That'll be the individual agent sales method. It'll also be recorded once it's done, and the website one will be as well. So, if there's no more questions,
Scott.
Yeah.
I had a guy that's actually on the exchange with me that was looking for a letter that we could send out if we're sitting down one-on-one with individuals, that we could send out to maybe our clients, just kind of an idea of, you know, do you know what your subsidy is going to be, and so forth, as a either do it via email or via or mailing it, and then following up with a phone call. Is that something that maybe you have been working on, or someone in our group that's been working on?
Yeah, actually, kind of both of the above. I started working on a phone script. I forget who I worked on. I had a phone script for defined contribution I gave to somebody, and it's up on the website as well. There'll be a healthcare reform phone script up on there by the first of the week. I'll probably get that finished this weekend. In conjunction with that, we were also working on an email template to send out to your existing clients, or just I guess it's basically your existing clients, or someone that's a warm lead that you can send out that will solicit people to, hey, give us a call. We can help you understand how healthcare reform is going to affect you directly. It's a fairly simple thing, and I think it was Jim that was helping me with that. And so we'll be working on that today and the next couple days. If all goes well, I'll have a version of that up, by the early part of next week as well. So just keep watching the website. There's going to be more and more content going up. Hopefully every day or two I'll be putting something up there that will be helpful to you. If there's a particular kind of a tool that you think would help you, I know I'm all about making you guys more effective in the field. And so if you need something, or if you think something might be helpful, give me a line, an email, or give me a call if you have my number, and we'll talk about it. And if it's something I think will work, I'll be happy to put it together and put it up on the site for everybody.
Okay.
So I think that we did pretty good. I managed to squeeze all that in an hour. I think I do appreciate your time, and I do want to commit to you that as we do our webinars, I'm going to make a strong point of valuing your time by starting on time and ending on time. Questions, of course, can go long, but the presentations themselves will be done in time, within the scheduled amount of time. So I want to make that commitment to you guys because I really value you and your time. So if you have any more questions, feel free to drop me a line. My email is scott@ianssurelink.com. You can contact me through the website, and I will be letting you know within the next day or two about the next scheduled webinar. All right? Thanks an awful lot, you guys, and ladies. I think there's a couple ladies on here as well. I hope you guys have a great weekend, and I look forward to talking to you again soon.